I'm Kim Adamski, HIV Prevention Specialist at the Hartford Gay and Lesbian Health Collective. I'm going to talk about the do's and don'ts of PPE, personal protective equipment, specifically gloves and masks. Alright, so first, masks. It's now recommended by the CDC, the Centers for Disease Control, to start wearing a face mask to cover your nose and mouth when in public, due to the risk of airborne transmission of COVID-19 through breathing or talking, even when maintaining physical distance. All right, so our first do. Make sure that you wash your hands properly for 20 to 30 seconds before putting the mask on. And don't touch the mask during or after wearing it. Make sure that it covers your nose and mouth. If it's a surgical mask, the side of the mask that has the stiff, bendable edge is the top of the mask. Make sure the bar on the nose is pinched to tighten against your nose. If it's a reusable cloth one, a scarf or a bandana, make sure the mask goes completely over your chin and nose. So here I've got a cloth mask for demo. There's plenty of tutorials online to make these if you have a sewing machine or a friend with a sewing machine. And I just made it out of a plain cotton fabric. You can use fun patterns. So to put it on, first, if you are a glasses wearer like me, you might want to take them off. So I'm going to do that. Oops. You put the mask over your face and tuck the ear loops behind your ears, like this. Now make sure it's completely tucked under your chin and over your nose. Then you can put your glasses back on so you can see what you're doing if you wear them. So nice and easy. All right. So hopefully that helped. Just make sure that you don't uncover your face to eat or talk. Don't wear the mask on your chin or forehead. So if you do wear them on your chin and forehead after they've been over your face, you could be transferring germs to other parts of your face from your mouth. Okay, so make sure that you do use only the elastic loops when removing it from your face. This will prevent you from touching your face or any contaminated areas on the mask. Immediately put the mask in the wash and never rewear without washing first. According to Dr. Mac Kerner of Dignity Health Northridge, you can spray surgical masks with 5% bleach solution and let it properly dry for reuse. If you're using a homemade mask, like I said, wash it between uses. Another don't. Do not use an N95 with a valve. These should be reserved for healthcare workers for specific purposes. They don't protect the people around you. Cloth surgical masks do offer some protection to others. All right, so let's move on to gloves. Again, make sure that you wash your hands for 20 to 30 seconds and make sure that your hands are completely dry before putting the gloves on. Make sure that you don't touch the outside of your gloves to your bare skin after putting them on, especially your face. Don't eat with your gloves on either. Wait until you've gotten home, taken them off, and washed your hands. The gloves are meant to act as a barrier between your skin and other objects like doorknobs, railings, and gas pump handles. So if you touch your skin or anything you plan to eat after touching your gloved hand to something else, it defeats the purpose. Okay, another do for gloves. Make sure you're aware of the surfaces you're touching, like keys, doorknobs, etc. We would suggest removing your gloves before you get into your car or house, as gloves would most likely be contaminated at that point from bacteria or viruses. Check out our guide to removing gloves safely, which I've linked to in the description. All right, one more do. Do wash your hands or use hand sanitizer if soap and water is not available immediately after removing your gloves. Remember, gloves are not a substitute for washing your hands. Hand washing is one of the best defenses we have from this virus. Carry hand sanitizer with you, if you have it, in case you don't have access to soap and water. Now please, please, please do not discard your gloves or mask on the ground after taking it off. Keep a trash bag in your car if you have to. Use the nearest trash can. Just don't leave it on the ground. Now, when you seal the trash bag, don't press the air out of it because any germs in the bag will spew into the air. Do you have any questions or comments on this topic? Join me for a live discussion on Thursday, April 9th on Facebook Live from 6:30 to 7 p.m. And stay tuned for a Spanish version of this video from Miguel Gonzalez, another HIV prevention team member, on Friday. And as always, be well and be yourself. Thanks for watching.